All right, everybody. So welcome to this month's Western Reserve Safety Council. I am Mike Hillman. I'm the Director of Business Development with the Solon Chamber of Commerce, and I'm filling in for Tom Bennett, who is just out this week, so never fear. He will be back next week, fearlessly leading our Chamber of Commerce into battle. So bear with me today. Hopefully I get through this smoothly without too many mistakes. But anyway, the topic for today's Safety Council is rehab medicine. And our presenter is Linda Kinser. She's with the Cleveland Clinic Solon Family Health Center. A couple things before we get going here. All the slides are available on our website. And I do just kind of want to run through some of the chamber resources and some things that we have coming up. And the top of that list is our job fair that we're doing in conjunction with the city of Solon. So anyway, June 3rd, mark your calendars, we have our job fair in the Solon Community Park. So if you're looking to fill any positions, please do register soon because spaces are filling up quickly. There's a $50 participation fee. So if you need any more details about it, just reach out to us or our own Kaylin Mills and help you out with that. Next, a couple other things just want to run through. As we're all returning to work here, if you're looking for any PPE on our website, we do have locally sourced PPE. So check out our directory, like if you're looking for any masks, sanitizers, stuff, as you head back, keep it local and check us out. We greatly appreciate it. Next, Solon Chamber of Commerce, we have a job board. So if you are looking to fill any positions, please do submit those to us. It's a benefit of your membership, and hopefully we help you get those positions filled. And another thing that the Chamber of Commerce has is an energy program. And frankly, it couldn't be easier. If you're looking to save money on gas and electric, just submit your latest energy bills to me, and I can let you know if we can save you money. From there, the process of signing up literally takes about 1 minute. Like I said, it couldn't be easier. And also, I just want to say it's also a way that we help fund the chamber. So if you could give us the opportunity to look at your energy bills, we'd greatly appreciate it. And again, just reach out to me and we can get that process rolling. No obligation to sign up. So it's a good way to kind of check your rates if nothing else. And also we do have a LinkedIn group. So if you can join that LinkedIn group, we'd appreciate it to keep the conversation going. Screen. Okay. The agenda for today. So pretty much right now we've got the welcome followed by a BWC update. And then we'll roll into our sponsor commercials. From there, we'll go into Linda's program. And then about 12:30, we'll have a Q&A period. So with nothing else from me, I'll go ahead and turn it over to Dan.
Hey everybody, good to see everyone and glad that the weather is getting nicer. So just a few things that we'll talk about. Again, the BWC sent more masks to employers since May. And again, I think they've shipped out another 23 million more face masks too. So just letting you know about those. Hopefully you've received them. And if we can go to the next slide, please. Thank you. The Indoor Air Quality Assistance Program. We have a program out there right now that covers improvements to indoor heating, ventilation, air conditioning. Again, there's the eligibility requirements, non-governmental, nursing homes, hospices, assisted living. And again, it's there to help improve indoor air quality due to COVID-19. Also, we have 4 grants. The Trench Safety Grant, which we introduced last year briefly. It's available to those who perform trenching and excavating. We also have the Firefighter Exposure, which combats firefighter cancer risks. We also have the Employers Working with developmental disabilities, and it assists with ensuring safety to their staff at nursing homes, not nursing homes, but those with developmentally disabled children and adults. And then, of course, the school safety grant as well. So we have that too. Next slide. All right. These are just some important dates for private employers. Just think about those. You know, a lot of these are in May and June and the first part of July. So the application deadline for drug-free ISSP, and then the TWB as well. So these are just some dates to think about too for those who are in the private industry. And then these will also be spelled out in the employer webinar as well. Public employers, again, some dates there. So May 28th, we have the group rating app deadline, and then other application deadlines too. So we have the deductible program, the one claim program, and the PAR program as well. Next slide, please. Again, the monthly webinars, the April 13th one obviously has passed, but we have the next one at 11:30, April 29th. And they're going to talk about COVID-19 responses, current initiatives, important dates as well. So all those dates that were shown on the screen, or a few that I highlighted as well, are also going to be in the webinar too. There's one for April 20th, engaging millennials in the workplace, from 2:15 to 3:15. So again, you know, these are free to you and all your employees. Virtual training. Here's a few classes that we have coming up, April 19th and May 4th. Some of the previous dates are shown here just for other individuals that work on my team that have safety council meetings before mine. But the electrical hazards one is 4 days, and then the accident analysis is on May 4th there from 1 to 4:30. Again, you know, we're still suspended from visiting employers, but we can do things through phone call, Teams, or anything else that you need. We're still here to help you out. And then, of course, you know about the COVID-19 resources. You can go to the ODH's website or BWC. They have an FAQ area as well. So these are all the announcements or talking points that I have. Otherwise, thank you very much, and everyone stay safe.
Thanks, Dan. Let's see, moving right along. Oops. I'd like to thank our program sponsor for today. It's CBiz. So if you are looking for accounting and tax services or insurance and HR services, please do reach out to Dennis Linden. His contact information is there, as you can see. And also, if you look at the map in the center, you will see that they have offices throughout the United States. So if you're looking for a company that has national caliber expertise combined with that local personalized touch, Dennis is your man. Going on to thank our founding sponsors, as usual. Thank you to the Cleveland Clinic, Nestle Integrity Staffing, Swagelock, and North Coast Shredding. And then I'd like to also thank our gold sponsors. And we do have some commercials for each of these. So Ving, Zerkoa, and Swagelock. And the first is Ving, and this is my biggest challenge of the day, so hopefully I can get this right. I'm going to go ahead and play a video here. So let me switch over to that.
Your employees need accurate, timely information to deliver quality work efficiently and without injury. The challenge? Ensuring they have the right information at the right time to complete the task at hand. Introducing Ving, the safety, quality, and HR compliance platform. Ving was built from the ground up for companies who face the challenges of staying engaged with an on-the-job, decentralized workforce. Whether on the manufacturing floor, at multiple locations, on the job site, or on the road making service calls, Ving ensures everyone has the information they need to succeed. Our content expert will help you pick the right courses for your industry. We've got you covered with courses ranging from OSHA-required safety training to state-aligned sexual harassment programs. You can even customize our courses by adding your own company messaging, checklists, assessments, and more. Interested in creating your own courses? No problem. You can develop a variety of company-specific assets, ranging from full-length courses and microbursts to checklists and company updates at no additional cost. Ving's robust features ensure easy access to critical on-the-job information for both employees and managers, and include multi-channel sharing, which enables users to assign training and share company messages via text, email, portal, QR code, or embeddable links. QR codes, which users can scan to retrieve location and task-based training, checklists, and safety tips. Microbursts, or short, engaging training, combining video, audio, images, assessments, checklists, and more. Dashboards and reporting, so users can create custom views for the task at hand, OSHA, insurance, customers, leadership, and reviews. Ving, your company, your needs, your solution. Take your next step and reach out to a Ving team member today. It's time to get your Ving on.
Okay. Tony, does Tony want to add anything to that? Are you on, Tony?
I'm here. All I can say is you did a great job of playing the video. So good job. You've overcome your biggest technical challenge of the day. Thank you so much. And
Excellent.
Thanks again for letting us sponsor this meeting. It's one of my favorite ones. So great job.
Thank you. Thank you for your support.
Yep.
And then next, SwageLock, always a great partner and very supportive of the Safety Council and the Chamber. So thank you to SwageLock. And then lastly, Zerkoa. Thank you to Zerkoa for sponsoring the Safety Council and Lenny. So Zerkoa, products that they produce are engineered ceramics, super clean crucibles, monoclinic zirconia, refractory shapes, dispersion and milling media products. And all of these things help build products that make our lives easier every day in industries such as aviation, as you can see here, technology, automotive industry, and medical, just to name a few. So thanks, Lenny and Zerkoa. With nothing else from me, I'll turn it over to Craig.
Hey, everybody. Thanks again to Mike. This was for those who have participated in a lot of these. Everybody took a breath of fresh air when Mike was able to successfully play the audio on that video. So forever we'll have something to hold against Tom. Couple of things. One, you guys are stuck with me today. Matt wasn't able to make it, but I'll continue on his safety quote of the month, I guess. I just attended a training and one of the professors emphasized this is most commonly accredited to Henry Ford. Occasionally Albert Einstein also gets accredited, but it's if you always do what you always did, you'll always get what you always got. It's a really cool kind of perceptive quote. Oftentimes us in safety can be a little bit stuck in our ways and but get frustrated when we don't get alternative outcomes. So it's something to think about. One thing I did want to mention is please feel free to reach out to me, Matt, Kylan, Tom, anybody else. If you guys have any ideas of topics that you want to ever cover, we come up with some really fun topics. We really try to engage the audience throughout the months, but we're always interested to hear what's relevant on your mind. So let us know for sure. Without anything further, Linda will jump in. Linda works at the Cleveland Clinic in Rehab and Sports Therapy. She's at the Solon Family Health Center. Her focus is centered around outpatient orthopedic practices. She started working at Cleveland Clinic in 1991 and got her was credentialed in 1999. So we're really excited. We have a combination of talking a little bit about physical therapy and certain approaches to rehabilitation, as well as tying that into COVID and some of the experiences we have. Feel free to throw in the chat any questions you have, either directly to me, Kylan, Mike, or put them in the public questions, and we'll do our best to address those.
Again. Hello. I wanted to thank everyone for inviting me to share my experiences as a physical therapist working at Solon amid COVID-19. Was a pretty interesting year and ongoing, and I'm hoping that I can meet your expectations with the information that I have to share with you. It's interesting that about 70% of you have experienced physical therapy. I'm not sure if it was during the COVID crisis in starting in 2020, or if it was prior to that. But this past year has significantly changed things just because of the impact and the rehab challenges that we have faced since the onset of COVID. So I thought I would start with just trying to give you a little bit of a taste of how things had evolved for us as rehabilitators at the Cleveland Clinic, because we are considered essential workers and we were still working. However, our community wellness programs, like our Balance community programs, were canceled. Our shared medical appointments were canceled. All of our volunteer programs, therapy student clinicals were canceled. Patients just, stayed at home and weren't coming in or just not showing up their appointments. And some employees, just with their comfort level, may have decided to take a leave of absence. It was a very, very few, but some had chosen to do that. So what happened with rehabilitation? We were pretty much reinvented. We reinvented ourselves. So we were asked to, help out, as a team in other areas where staffing was needed, just in critical areas. So a lot of training in learning how, going from outpatient to inpatient rehab services. We had training to go through the process to learn telehealth, whether it was Zoom or FaceTime or Google Duo. There was also training in providing relaxation stations for frontline workers in our regional hospitals. We did temperature screenings in the hospitals and temperature screenings in all of our family health centers. So we just triaged the need and went where folks needed us. So that's what we ended up doing with our time when we weren't seeing patients in the clinic. So just daily briefings on COVID updates, employee and patient safety and health was like key, and learning this whole process. And every day seems to be, learning new things every day just to keep things going, to keep us safe and to keep our patients safe. And then vaccinations came around and all the, the fear and apprehension. Is it safe? Is it not safe? So, we're going through this whole process just like everyone else is. Still dealing with day-to-day life, with our families and friends and, the distancing. So with telehealth actually was interesting because, physical therapy, rehabilitation really is something that needs to be in clinic, in-house. We did do some telehealth. In a moment, I'll just share some statistics with you versus clinic versus telehealth visits in comparison, so you have a better flavor for that over the year. But by the end of 2020, mid-2020, and as of now, telehealth this month is expiring. We're no longer going to be doing telehealth. We've had patients, fall during telehealth visit. That's tough. If you're trying to do a balanced patient over over a computer screen, and that's hard. That's hard to see that kind of stuff happen. Not frequently, but I've heard that it had happened to a couple therapists. Department changes that are likely to stay is all of the virtual training that we've all learned to experience. As myself here with the Zoom meeting, this is my first time experiencing something like this and presenting. So probably 2 years ago, I'd be like, oh, I can't do that. So it just gets that comfort level going for us all. It has really improved our staff involvement, where we're doing these online training modules continuing education courses, meetings where someone from across town may not attend the meeting because it's too far away. But now that we're doing it through Teams, they're attending. So we're getting increased staff involvement. And it also allows us an opportunity to increase our schedules for patient access to see more patients because we're spending more time in the clinic and less time on the road. So I foresee all of those types of changes to continue on. So what we know, we're still learning. We're following the CDC guidelines, as everyone knows, and we're just trying to stay informed. Next slide. So this is just a snapshot of our department, just to show you how we have had to make some changes in our clinic. I've actually had to remove 2 large pieces of equipment so that we could space things out to have the social, physical 6-foot distancing between each one of our workstations. Fortunate for us, we're a small clinic. And so with 5 physical therapists, it's nice because we can space out easily and still accommodate the workforce and the workload that we had prior to, as well as patients become more comfortable to come in. So next slide.
Okay, so I'll just launch this and give it a I don't know, maybe like 30 seconds for people to answer. So does your organization have a wellness program? Looks like people are responding pretty quickly here. Give it about another, I don't know, 10 seconds. And so you can see the results here. It looks like about 39% have a wellness program and 61% do not.
Okay. So the Cleveland Clinic does have a wellness program. It focuses on, we're finding that it allows for a healthier workforce. It helps increase morale, and it also is reducing healthcare costs. Our wellness programs focus on physical activity, weight management and nutrition, and nicotine cessation. It's just part of our health plan. So with COVID, what we found with physical therapy in particular is we're getting referrals from employees who have sort of fallen off track with this. And they're requesting help to get back into their job and their activity and their health and their wellness. So these poll questions were a little bit different than I thought I had set up, so bear with me, okay? So let's switch to creating a safe workplace. So the Cleveland Clinic has a great resource for businesses who are working on trying to get their employees back into the workforce. It helps employees return to work feel safe and confident to return to work. It also provides some help for employers to help develop and implement a plan for return to work. The drawback I see at times with return to work is that the longer someone is home, the more comfortable they do get with that, or they're less interested in returning to work. Sometimes I even hear patients tell me that. So next slide, please. Can the next slide come up?
The next poll question just up real quick, and we'll let people answer it. So the question is, how long have you worked from home during the pandemic? So we got the results coming in. I'll give it about another 10 seconds and then we'll go.
I apologize, guys. My questions are a little bit in a different order than what's being posted. So
No, it's not a big deal. I think we just we moved some slides around and forgot to shuffle the questions. So, but it's all good. So I'm going to go ahead and close the polling here and share the results. Looks like 43% have not worked from home during the pandemic, 14% 1 to 3 months, 5% 4 to 6, and 38%, a big chunk, 6 months plus.
yeah.
And then I'll just go ahead and, there you go.
Okay. So I just wanted to backtrack a little bit in regards to rehab, the Cleveland Clinic Rehab and Sports Therapy Department entity as a whole. That includes the East region, South region, Maine, and then in our area. So in the beginning, when COVID hit, the pandemic hit back in March, we were seeing clinic visits, like 2,700 visits. And telehealth visits, when they started kicking into place, it was about 39 visits, over 1,274 visits in clinic. So we were still involved with seeing those patients. And there was a huge drop in those in-clinic visits. But we started ramping up, and by May, with all the training that we had experienced to provide the telehealth, the telehealth visits really never went above more than like just under 300 visits. And these are per day versus in-clinic visits of like 2,000. If that just gives you an idea of how we've been trucking along here to have the visits on site with patients. But right now at this time, we are recovering well, and televisits no longer are available for patients. And our in-clinic visits, we're getting back to that normative level of about 2,700 per day visits. And that was over about 8 months where we're starting to recover and improve with that. So when you think about rehabilitation, we have exercise physiologists out there, we have personal trainers, chiropractors, PTs, we have aquatic exercise specialists. So I thought I would go ahead and put in what the American Physical Therapy Association, how they define what we are as physical therapists, to help you better understand that. So physical therapist is we're licensed medical professionals with experience in clinical diagnosing of physical abnormalities. And that could be related to an injury, medical disease, or condition. We specialize in restoring physical function and mobility, and teaching patients how to learn to do that for themselves as well as maintaining that physical function. And we promote prevention training, physical activity, and proper ideal normal movement or proper function. Next slide. So have you had any aches and pains in the past year? Have you sought medical attention? And were you referred to PC?
Yeah, so we'll just give this about another, say, 20 seconds or so for answers to come in. It looks like they're coming in pretty good. And this is our last poll question, just for those of you that are playing along at home. So I'll go ahead and close it out here and then share the results. Have you had new aches and pains in the past year? 80% yes. 20% no. If yes, have you sought medical advice? I sought medical advice but wasn't referred to physical therapist, 90%, and then 10% were referred.
So that's what we're seeing in our clinics. For the folks, who are coming in, a lot of their lifestyle habit changes, no longer working in their offices or out in the industry or at the schools, they're at home. There's these family dynamics where they're trying to be a parent and a school teacher, at the same time, and do homeschooling with their kids. People in the industry now at home, working in their makeshift computer areas in home. Very poor setup is what we're finding. And it's typically happening within 3 to 6 months of these changes with their lifestyle habit changes. So, what we see is that, an average person bends just normally 4, maybe up to even 5,000 times a day. And the 2 common predisposing factors for the presentation of no apparent reason, there's no trauma, but all of a sudden people are starting to have these neck pains, these back pains, maybe even some symptoms going into their arms or their legs. And this is due to prolonged poor postures and high frequency of bending. We know that frequent performance of movements, that eliminate symptoms also can help prevent symptoms from returning, while you avoid those movements or positions that actually produce those symptoms in the first place. So it's just like this vicious cycle. Unless you can really identify with it, it can be quite debilitating for some. Next slide, please. So what I thought I would do for you all is try to provide some healthy, fun, user-friendly, immediate tips that you could, use immediately, whether you're at home or you're in your work office. And know too, if any of the things that I'm discussing with you, any of these self-interventions don't feel good or they're making you feel worse, you probably should be seeking some medical advice or seeing a physical therapist. And hopefully your doctor refers you. If not, you can always ask your doctor if you could see a physical therapist. But this is a very typical ergonomic picture for your workstation. And so if you think about it, maybe you don't have that ideal setup at home, but you can use like a lumbar support, or you can roll up a towel about 2.5 inches thick, put it in your waistline to try to help hold you in an upright position. You could use your fingertips at your chin to help pull you up and back. It's almost like, I teach patients, to do that car mirror check. When you first get in your car in the morning and you're sitting up in there and you adjust your mirror, how does that fare later on in the day? When you go back into your car in the evening, do you take your mirror and bring it down to you, or do you correct your postural alignment so that you don't have to adjust your mirror? So these are just little things that you can use right away. And if any of these kinds of sitting positions are bothering you, I would seek advice, because it shouldn't be that way. Sometimes too, it makes it easier if you drop your knees actually a little bit lower than the hips, especially if you're getting hip aching.
Hey, Linda.
Yes.
One thing that does come up commonly from work from home employees is, even the folks that are able to set up a workstation really nicely like this, they still say, oh, I have such perfect posture, but I'm still sore at the end of the day. And at times it's like, well, how long are you sitting in that position? Oh, 8-10 hours a day. It's like, well, that's why. Are there good rules of thumb that you'll give your patients to say, hey, one of a nice quote that I've heard before is that your best posture is your next posture, really trying to encourage people to rotate. But are there rules of thumb you'll offer to people to change postures?
Yeah. Our bodies can only withstand a sustained position for 10, 20 minutes at the most. So changing those postures and movements, even in sitting, is pretty helpful. And in fact, that's sort of where we're going into the next slide. So I thought what I would take these static postures and show you all how you could apply some movements. So say someone has more neck aching or upper thoracic, mid-back aching. These are a few things that you could do straight away. You can even experiment a little bit now while you're sitting in your chair, where you hold on to the back of your neck just to support your neck. And you can lean over the back of a mid-back height chair, or pull away from the back of the chair if it's a high back chair, and just lean back and just do that repeatedly, 5, 10, maybe 15 repetitions at a time. There's a couple of exercises also on here that you can use as a reference where you're rolling your shoulders around and back, or you're squeezing those shoulder blades together. Give it a good 5-10 second hold, and then slowly release. Very often, the culprit is a forward head protruded, shoulder elevated position. And that's why the choices I'm giving you there, that's why I'm giving you that, because it's reversing that forward posture, forward head load. Make sense? So I just encourage you guys to give it a try as I go through a couple of these ideas for you, okay? And also, if the chair is a little bit too sensitive there behind your back, you can always tuck a pillow back there, something soft to lean over the back of a pillow, which is really nice too, very comfortable for patients. The next slide goes over a particular exercise that you can do in sitting. I'd love it if everyone would give it a try. So if you can just pull away from the back of your chair a little bit, and then this really helps activate those posture muscles that are attached from the back of your head all the way down to your butt. So if you just sort of slouch in your most best slouched position, and then you reverse that, drawing your shoulder blades together, sticking your chest out, pulling your chin in, get up onto your butt bones, okay? Bend those hips up, and then reverse that. Go ahead and reverse it back into the slouched position. And you're gonna hold your head looking forward the whole time instead of looking down at the ground. That way, you can reverse the flexion and extension occurring in your cervical spine or your neck as well. So you're just going through each one of those motions, the extreme of motion, and you do that at about 10-15 repetitions. And then the last one, the 15th repetition, you hold it for a good 5 solid seconds, super exaggerated, and then release 10%. And what that does is it drops you into your ideal posturing alignment. It also helps reduce the fatigue from that prolonged sit position. And you know, it's a very helpful tool to prevent things from coming back. So, you know, the more proactive you are, you may actually be able to get through a couple hours of work that you can't interrupt a meeting for if you're not able to get up and move around. So it's just an idea for sitting, dynamic sitting. Next slide. So if you're an individual who has to stand prolonged, there are ways that you can break up the fatigue of that prolonged standing as well. And so what this particular slide is doing is just to help you identify how to actually engage your core muscles in a standing position. So if you imagine a string pulling your head to the top, you know, to the ceiling, it pulls you up and it helps you pull your shoulder blades back and down, space your legs a little bit, tighten up your abdominal muscles, tighten your buttock muscle, and don't hold your breath. And try that and see if you can do it. It's not so easy, but with practice and over time, you can really engage those muscles to help support your posture, support those joints and those ligaments that you tend to hang on and rest on over time in standing. The thing to think about whenever you're standing, say you have a standing workstation, which is really nice to have. You can always adjust the height of that workstation so that you're not leaning over it, and change your positioning by maybe placing one foot up on like a 4-inch box, and then you can alternate your foot position left and right periodically. You could do some heel raises where you're just coming up on your toes. You could do some little mini squats or marching in place. Any of these types of activities just interrupts that prolonged static load of just standing in one spot. Next slide. So note too that with this particular slide, if these bother you, or if it's producing symptoms down into your legs or your arms, or if you're not able to get up and down from a chair without requiring hand support, probably be a good idea for you to seek some help or practice it and see if you can just get better on your own in doing it. But just simply by practicing sit to stand in a repeated manner allows someone who has prolonged standing demands or prolonged sitting demands to break up that fatigue by simply changing and altering your direction, your position throughout the day. I'm curious, you know, I know it's not one of the poll questions, but I'm just curious to know how many folks that are actually on this meeting are able to get up and down out of a chair without requiring help from their arms and their hands to support them. The standing back bend to the right, you place your hands in the small of the back just to protect your spine. It should be in a very relaxed, smooth, rhythmical method with your knees, your feet, spaced apart a bit, so that you can just sort of counterbalance and allow a full relaxed state to occur. And if this bothers you though, please hold off on it. It's tough when, if somebody has some mechanical problems where it's pinching laterally. This may not be the best idea for you to do. And, by the way, the one on the left where it goes from sit to stand, we even have normative values for people from starting at age 18 all the way up to age 94, discussing fall risk and how many you should be able to achieve in 30 seconds. So, for example, if you are, age 55 to 59, I'll just give you a couple of examples. If you're a female, if you are less than 14 repetitions in 30 seconds, you're at risk for fall. And if you're less than 15 repetitions for a male, you are at risk for falling. So we use that a lot as for a functional assessment to see how someone might be progressing in their therapy. Next slide, please. So lifting. So there's a lot of information out there for lifting carry principles. And so what I tried to do was think of all possible scenarios that people may be needing some tips, whether they have some neck pain or back or some extremity or low back pain, and whether they're moving, carrying things, whether they're at home, like somebody carrying a laundry basket, compared to somebody who's in the workforce carrying boxes or moving things from pallet to pallet. So if you think about these tips and try to walk yourself through these scenarios, maybe you might find some of this helpful to you in particular. By maintaining good posture throughout the task, test the object before lifting it. If it's too heavy, ask for help. Tighten your stomach muscles without holding your breath. Use smooth, controlled movements. Avoid jerking, quick, momentum types of movements. And by the way, whenever you're working on slow, controlled movements and relying less on momentum, it is an amazing, strengthening, functional exercise for you. You can even use stairs as an example for that. So if you're going up and down the stairs and you're just trucking along using momentum, you're not going to get much strengthening out of that. You just get from one place to another. You should try going up and down the stairs slowly, as though you're trying to sneak back in the house at night, or you're trying to sneak out of the house, because it engages those core muscles in your hips and your pelvis. And it also helps you control whatever you're lifting and carrying from upstairs to downstairs. Keep objects close, distribute the weight evenly. If you're turning from different directions, to lift and carry things, if you think about having your head and your feet face the direction of your task, it's a much better way of approaching things versus twisting, where your feet are sort of stuck in tar and you're moving from your upper body first. Always think to lift things with your legs, hold your head up high, and use both hands when you have an opportunity versus picking things up with just one arm. It keeps you from rotating excessively through your trunk. Next slide. So I'm just sharing our mission that's posted on our website for the Cleveland Clinic Rehab and Sports Therapy Department. Our mission is to meet the rehabilitative needs of our clients across the healthcare continuum. Patient-centered and evidence-based practices are used to foster optimal function, and we are committed to development and education of those who serve. So if you have any questions, or if you'd like to get in touch with an area that might be able to help you, there are facilities everywhere. I've just listed just the 10 facilities that's really very close in our east location, but we have locations southwest, main, west, and so this appointment line that I have posted here, will be able to help you identify with a facility that might be able to meet your needs. And we have facilities in Worcester and Youngstown, just to give you an idea. Next slide. So key takeaway, know that we are committed to our mission. We never went away. We are still here and practicing all the safety guidelines to keep everyone safe and comfortable. And we promote that safety, the health, and the wellness of ourselves and everyone else. I mean, that is our priority. So thank you.
All right, Linda. So we've had I had a couple questions that came up, and maybe we can start first. The first half is more focused on COVID, and then the second is more on the rehabilitative medicine and physical therapy. So with as you were talking, I kind of realized you guys have certainly dealt with some of the challenges that we've had with COVID protocols and people mask adherence and things like that. But almost to a certain extent, it's probably been even more challenging. How have you guys dealt with, and feel free to tell me either you can't talk about it or I can't get specific, but how have you guys dealt with situations where patients have been resistant, let's say, to wearing masks or whatever protocols it might be that obviously you're trying to protect your practitioners?
So, I've not found, in our particular department, we have not had any resistance from patients. I've had one patient, however, who medically was unable to tolerate masks, who was on oxygen. So what I did was I am not exposed because I'm wearing my face shield. I have my mask. I use gloves, and we use a private room. And so we take them directly to the private room, give them the care that they need, and everyone's safe and comfortable. I've had patients who have been exposed to COVID, who have had COVID, and that's what we do. And it's really based on a comfort level. My women who are pregnant, always we go to a private room, and patients are very open about things. They'll message us and say, hey, blah blah blah. Can we do it in a private room or something? And that's what we do. So hopefully that answers your question. But
Sure, that's helpful. Maybe a tangent off of that is, have there been, I guess I'm making an assumption that there have been situations, and it seems like there have been, where maybe a patient's been exposed or has had COVID or things like that. Has the approach for your group been, hey, with the PPE we're wearing, we're protected? And have you had any circumstances where you've had to do contact tracing or anything like that because of exposure? No.
Not in our department. We have not. We've had one clinic who was shut down for 2 weeks in the very, very beginning because of a COVID exposure. But I'll tell you, with all of the universal pandemic precautions that we follow, and the Cleveland Clinic honestly is taking such good care of us in terms of communicating what the needs are to be in place to keep us safe and to keep our patients safe, has been a blessing.
Yeah.
It's been difficult in the beginning because, therapists are wearing multiple hats now. We are the house cleaner and and we're getting our patients. And so we've just learned, to space things out, to space our schedules out accordingly, so that, from the time we greet our patient in the lobby, we are wiping down with disinfectant the chair that they sit in. And it's so just normal now for the therapist that we know exactly what to do. No one needs to be reminded, everything just sort of flows. And so, some of the patients, just out of courtesy to us, they don't even sit, they're in the lobby. They know we're on time and we're sticking to our, our schedule. So they just sort of stand there and they'll say, don't have to wipe, I'm ready for you. And they don't even sit. So that's where we're at.
That's great. No, it's amazing, to your point, how many different hats some of us have found to wear over the last year or so because of some of the challenges that COVID has posed. And I know, especially in healthcare, it's been a very different situation. To the point earlier, though, it's we've had several situations where there was a pretty close proximity that individuals that tested positive came with others. And I think it speaks to the effectiveness of masks, that whether it's some of the scenarios you're describing, I know we've had some that we haven't had transmission within the workplace, and despite some of the issues with social distancing. So it's hard to debate that.
I mean, and we're all still learning, right? But so far so good. We have all been healthy, and we've really pulled together as a team. And I think if anything, it has just actually brought us closer.
Sure.
You know. So.
Now, Linda, do you think that any of the you described some of the processes, any of the processes you've taken from or kind of were created by COVID or manifested themselves? Do you think you'll keep any of those, that you'll just continue on?
I hope we don't have to wear face shields anymore. So I'm looking forward to the day where it's no more face shields, no more masks. The gloves is no different than we would normally use them anyway. We really have to use our professional judgment on whether wearing gloves is appropriate or not. I just think it makes us more mindful and compassionate and understanding to make it work for everyone. And patience, patience is a virtue, and we learn that just through practice. But we've always been safe, and I just think the two big things are the mask and the face shield. I'll go home and I'll still have a face shield on, not realizing that I'm still wearing it, or a mask, or vice versa. I start my day and, because I wear glasses if I'm not wearing my contacts, and I think I have my face shield or my eye shield and I don't. It's like, oh shoot, I got to go get that put back on. So it gets a little blurry with that, but we look out for each other.
Sure. So you had described an increase in, and I'm assuming it was probably somewhat anticipated, an increase in some of the issues relating to sitting and poor setups at home. Mm-hmm. Are there the listing of movements, things like that you showed, is that pretty much the comprehensive list, as far as if some of the folks on this call are saying, either for themselves or for their coworkers, to say, hey, here are a few things you might want to do? I thought you put it really well. I mean, I know it's a simple comment, but movements that eliminate the discomfort are also potentially going to help you avoid the discomfort. And I thought that was just kind of a nice way to put it.
I mean, if you have that, then typically you're able to manage your own problem, your own symptoms. But, physical therapy is so patient specific. And, I've been practicing for almost 30 years now, and I honestly don't ever recall in my mind ever treating this, anyone the same way. Everyone comes and presents with their own specific situation. And that's why I was sort of, I'm really reluctant to just eclectically throw out information there when I know it may work for this particular individual and it can have the exact opposite on another individual, which you really don't want to have happen. So, when they come in, we provide a very thorough history and listening to the patient. And then we take that information and we take them through a mechanical assessment to determine, how certain positions, how movements may or may not help them. And so once we identify these matches, we educate the patient through that process and get them going on a program. So we're basically, looking for direction preferences. Do people bias and prefer, in other words, their symptoms feel better when they do particular movements versus and typically the exact opposite makes them better or worse. So we're talking about like sagittal plane movements or lateral or rotation. So that's where it gets a little bit more specific to a patient. Does that make sense?
Yeah, that's helpful. So in other words, the content that you provided, it's a really good start. Obviously, to the points that you made during the presentation, try to people need to be conscious of, hey, what's normal pain, what's concerning pain, and if they're feeling that and it's continuing, then they should seek treatment. But these are good ways to start that should be minimally invasive, but also help to reverse some of the issues.
Especially if it's an acute episode, where they were doing fine and then all of a sudden, boom, for no apparent reason, they're having these pains, and that's not normal. What, being able to get up and down or move around yesterday was not painful, it shouldn't be painful today. And the sooner you get that in, that intervention and understand how to shut that pain off, the quicker you're going to respond and the less likely it's going to come back, because you're going to learn how to make those changes. But the more chronic a condition is, when people are waiting and waiting, oh, it'll go away, it ends up becoming more of a monster than it could have been. So.
Sure. Yeah, I think a lot of people don't realize, and it's something that I personally experienced. I shared during our pre-call that I had a very positive experience actually at the Solon a location with a therapist, and it did take me some time. People think either if they go from very active to inactive or less than active, their bodies change and they adjust differently. And especially if you're sitting more and you're used to being out on the floor walking around, you need to address that, because otherwise muscles adjust and things. And for me personally, my experience was also that I needed to find a physical therapist that kind of matched with my personal goals, physical goals, and what I was interested in. And some of the movements that you showed in this presentation were ones that he encouraged me to do. And at first I was like, oh, come on, this is not a big deal. But I think it was 10 reps, 10 times a day. I did the stand up and bend backwards, the hyperextensions. And that was the step in the right direction to really rehabilitate and move on. So one question did come from the group. I'm not sure how much or if you're able to say this off the top of your head. And I'm wondering if Barb was one to ask the question, because I had a similar one. Are any of the locations that you listed tied to or actual occupational health clinics?
What do you mean by occupational health clinics specifically?
So
therapy departments?
So it's actually, so instead of being like a primary care provider, their actual focus is occupational health, is maybe a better way to put it. And maybe to elaborate it, and anybody in the group, feel free to put something in the chat. I'm curious if this is where Barb was coming from. We're located in Aurora. One of the biggest challenges we have is truly the closest and most helpful occupational health, meaning if a person gets hurt at work, or we think there may be an underlying condition that's related to work, our experience as employers at times can be either send them to their primary care, and it can be a bit hit or miss the type of treatment they get. Oftentimes it's a kind of a wait and see. They're not really getting this active and helpful and progressive treatment to return to work. It's more about, oh, you know what, take a couple weeks off, see if your back feels better. Alternatively, they go to urgent care. And urgent care, they're like, are you dying? Are you going to die anytime soon? If not, then I don't really need to deal with you right now. I'm going to send you to a specialist of some sort. Occupational health really helps be that bridge to say, I understand from an occupational standpoint what you're trying to accomplish, and what they take time to learn what the employee needs. I'm sorry, what the employer does, I should say, but then also working with the employee to return back to work. That's been an issue, at least in our region.
So we see Bureau workers' compensation patients. We see BWC patients, if that's what you're asking. So when someone's having a problem and whether they go to our express care or they see their primary care, or they're being triaged on the phone as to who they need to see, most of the time with these acute episodes, they go through our express cares versus the emergency room. They're just triaged to go through express care. And so we have what we call RSQs, where you can see a physical therapist through the express care physician for acute low back pain. And it doesn't necessarily mean that it's, unless it's a Bureau workers' comp, then you're still seen by a physical therapist. And am I answering your question? We don't actually have a facility that just strictly does occupational health, to my understanding. I mean, I can look into it further to maybe better answer that question and get back to you on it.
Sure, that's fine. Linda, we could,
bureau patients. I see bureau patients. Some patients decide not to go through the bureau. They just go through their personal insurance or private insurance when they work.
So it's more that the referral to you, Linda, might be coming from an occupational health when it's things for the bureau. So by the time they get to you, those steps of work related versus non-work related are already identified. So it's who that referral is coming from. Typically might be an occupational health provider versus a primary care provider.
Yeah, so we primarily get the primary care or the express care. Sorry.
no, that's fine, Linda. And we could always talk offline. And if there's more information, I can share it with the group. And we can make sure Kylan or anybody on LinkedIn or somewhere to get it out.
Yeah,
I think it seems like Lori has a similar experience, but it's that conduit between work-related injury and then getting to you that oftentimes is not the best experience for employees.
You mean they're probably waiting for authorization through the bureau?
It's less even the administrative side. It's more just having a good experience, getting the right type of doctor that's going to help them put together a treatment plan and link them up and diagnose what's going on, or at least make an assumption what's going on, and then link them up with you as a physical therapist. I couldn't tell you how many times where a person has an injury at work, and truly I think what they need is some coaching physically, how to adjust and how to rehabilitate. But they go through quite a few hoops, getting bounced between urgent cares, then go talk to your primary care physician, go to the orthopedic surgeon, rather than going to oftentimes the occupational health clinics. They understand that the work that's being done, the goals of the patient, and then how to get them back to work.
So I know the clinic has occupational health for us. Right.
Craig, this is Barb.
Sure,
I finally got unmuted. I was the one who asked the question. Hello, Linda, this is Barb, and I'm with Sedgwick, and we do absence management, workers' comp, and all kinds of disability related. And so I particularly do workers' comp. And I did say when I sent the message to Craig and to Kaylin, I did say, well, this is probably an off topic, but when you listed those Occ Health clinics, I thought, when you listed those clinics, I thought, I wonder if any of them are occupational health clinics. Craig, you did a phenomenal job talking Linda through Occ Health clinics versus, or what the Occ Health clinics do. Their role is to, they understand the workers' comp process, the paperwork, they understand the rehabilitation associated with returning somebody back to work into the labor force for manufacturing, et cetera. They understand, transitional duty, return to work, and of course they understand all the rehabilitation, which includes physical therapy, and physical therapy for the most part. That's really majority of claims. So so you did a good job, Craig, and Lori, you chimed in. Thank you. You did as well. So sorry to put all of you on the spot with that question, but and I just wondered if any of those were occupational health clinics. There is Cleveland Clinic's Occ Health clinics are Garfield over there on Transportation Boulevard. And then there's another one in Medina on Washington Street or Route 18. So that much we know. I think we know that across the board. I don't know if you need to research that. I can find out that information. So I don't want to put you through the hassle of having to research that, because I could find out that information. I just wondered if by chance you knew off the top of your head. So sorry to.
No, I mean, we're primarily
on that.
Primarily family health centers and rehab sports therapy centers.
Okay, yeah. And then for the therapy post injury, for the therapy, they could very well be going into your clinics for the care that they need.
Yeah. And for the folks who get functional capacities evaluations or physical capacity evaluations, those are operated through our occupational therapy departments.
Yes. Yeah, and they do. Many times we do the FCEs, the injured workers need the physicians of record do the FCEs. So yes. So yeah, so it's sorry to catch you all off guard on that question, but you all did a nice job walking through that.
Thanks, Barb. Yeah, Barb, maybe what I'll do, Linda and I can collaborate after and talk a little bit more about some of the pains that we're, I guess, no pun intended, that we're all experiencing with that. And it is something that is a little surprising with Cleveland Clinic and UH being such strong organizations, how little support from an occupational health standpoint we have in this area. So there may be something there. I'll let the group know if we find anything interesting.
Yes, there may be, and we'll see. Yeah, we'll see.
Cool.
Thanks for the feedback.
All right. If anybody else have any questions, if not, then we can wrap things up a little bit early. I won't say the joke that Tom says every presentation too, that we're going to wrap up at 4 o'clock or whatever he usually says. Well, thank you, Linda, for your time. This has been really helpful. We're really excited. To be honest, I'm excited to take some of this content, at least push it along to folks that are working from home to say, yeah, it's been pretty crazy on site and being in person during COVID, but we understand also there are some challenges at home, and so we appreciate all that information.
Okay, thank you.
Thank you so much.
Yeah, thank you. Thanks, Craig. Excuse me. Thanks, Linda, for a great presentation. Thanks, Craig, for sparing us the Tom humor. It's been a nice break for us all this week. Anyway,
thanks, Mike, for sparing us the Tom video.
yeah, there you go. There you go. And Linda, seriously, thanks for giving us some common sense tips. I have had that neck pain. So anyway, you know, I have moved my monitors, and the idea of doing these basic sort of posture exercises, I think, is something that'll be, you know, helpful for me. So thanks for that.
Mm-hmm.
And thanks everybody for attending. Before we wrap up here, I just want to let you know what we have coming up at the chamber. So we have an update with Robert Sprague, the Ohio Treasurer, coming up. That is on the 27th. So you can register for that through the Solon Chamber's website. And then we also have what we're excited about, some live networking coming back. So we have an after hours at Adrenaline Monkey on, if you haven't been there, it's very cool. Looks like a lot of fun, and really could probably get you some new clients if we do it right, because I could see a few people taking some falls. There's some Tom humor. But anyway, that'll be April 29th from 4 to 6. And we hope to see you all there. Thanks again, and have a great day.
Thanks, everyone.
Thank you.